what other bone can be in its correct position and deviate almost over 90 degrees? Okay? That is the strength of the joint. The strength of the joint is its mobility. Okay? The strength of the joint is its mobility. And then, like a lot of things, I always like to think of singers. You know, who gets more sore throat or throat issues than singers? I mean, they have throat issues all the time. So oftentimes, our strength can be also the weakness. And so what can tend to happen with the shoulder is we take advantage of its mobility and we reset its neutral position 90 degrees away from where it should be. We clear on that? We know the bone can over-rotate. We know the bone can rotate and redesign where its neutral position is. How easy is it for you or for individuals you work with to see this humerus rotation? So you want to get a look from the side. It's very hard to see from the front. And then go ahead and just keep, there you go. Okay? And it takes nothing for us to create that deviation. Thank you. So,
could you also look at where someone lays their hand? Is that?
Yes and no. The classic example is that there's a tendency when we reach or grab for something that we use our whole arm, right? Someone grabs like this, and we reach like that. And the idea is we can be here and here, so that it can be hard to separate the movement of the hand with the movement of the shoulder. So for example, let's put your palms up and bring your hands up maybe like 3/4 of the way. And then without moving this part of your elbow, right, the soft part of your elbow, just rotate your hands inward and see how that goes, right? So how much mobility are you having that's only in your hands, and how much is happening with that humerus? And now just do it the other way with the humerus, right? You can imagine that this movement and this movement would often be seen as the same, right? You see the difference though, yeah? Okay? So that's an important biomechanical correction that we want to make in asana and also in sort of the day-to-day movement habits. If I'm going to be operating a mouse and I'm using my hand forearm, then my humerus is happy. As soon as I start using my hand, my humerus to operate the mouse, now remember, we started many classes by saying if you want to understand movement, basic movement, I believe it helps to just follow the bones. We'll worry about the muscles later, right? If we want to talk about movement in relationship to the muscle of the humerus, as you see, I mean, that's a very complicated conversation. If we want to talk about movement of the humerus as a bone, it's very simple. It rotates in, it rotates out, things like that. So when we're helping individuals and we see they have certain patterns in their asana with the humerus rotating medial, we can assume they're going to have that in whatever their jobs are or whatever they're doing in their life, whether they're doing, with children, whether they're doing a lot of cooking, whether they're doing a lot of different types of garden work, whether they're doing art, whether they're in a profession that's manual. If it's not happening in their asana with all that attention and slowing everything down, it's not happening in their day-to-day life. Nice to see you. And that's where we can start to bridge the gap as yoga teachers between teaching yoga and bringing about yoga therapy. Because we understand that there's a correlation between what happens in asana and what happens in day-to-day life. So why not have our life support our practice and our practice support our life? And this humerus deviation is at the crux of so many shoulder problems, and it's at the crux of almost all the shoulder solutions. Okay?